in today's post we're going to be talking about whether you should be taking synthetic or whether you should be taking natural thyroid hormones. And I get this question a lot. I say, what's better? What's better? Is it Synthroid or is it Armour? And the answer I have for people is, I don't know. Maybe you do better with Synthroid, or maybe you'll do better with Armour. The point is that whether it's synthetic or natural really doesn't matter. If you need hormone replacement, which you may, then you need to take something potentially, because the most common cause of low thyroid, if you remember from my other post, the most common cause of low thyroid in this country is a condition called Hashimotos, or an autoimmune process against your own thyroid. So in other words, there are antibodies that are attacking this thyroid gland, and these antibodies are destroying your tissue as we speak if you're not taking care of this autoimmune process. And what I mean by that is, by taking the hormones, you're not addressing the most common cause of your low thyroid. So you must address, in addition to whether you're taking synthetic or natural, you must address this process. There's no cure for it, but the idea is you need to modulate that immune system so it slows down or modulates that immune system downward to stop the destruction of that thyroid gland. And whether you're taking synthetic or natural doesn't really matter. For some people, for instance, some people don't do very well on Synthroid, and the reason may be is because in Synthroid is a filler called acacia, and acacia is a Th2 dominant substance. And what that means is, between Th1 and Th2, if you've looked at my other post, there's this seesaw act in your immune system that needs to be balanced out in order for you to modulate that immune system down. So if you're taking substances that are Th2 or Th1 dominant, you can skew your autoimmune process into the wrong direction, and that's how you can start feeling worse. Whereas other people don't have that sensitivity to acacia, and they do better on Synthroid than on Armour, for instance. So whether it's synthetic or natural doesn't matter. You may need your hormones, and you shouldn't be going off your hormones without your doctor's supervision, but you need to find a doctor that understands the aspect that if you have low thyroid and it hasn't been taken care of by going on whatever hormone you're taking, that there's a good chance that you are autoimmune. And if you haven't been tested, you need to be. So you need to find a doctor that understands these concepts, that will work with you to help you modulate that immune system down so it stops the destruction of that gland. And whether you need synthetic or natural all depends on your body and how it's doing. So you can actually challenge the body to figure out, are you Th1, are you Th2, if you are autoimmune thyroid. So in order to find out if you're autoimmune, you do need to check these antibodies. And these antibodies, if you've already been checked for those antibodies and they were negative, you should be continually on a periodic basis checking for them, because again, 70 to 90% of the people in this country that have low thyroid, it's due to this autoimmune condition where the body's immune system is attacking the thyroid. So keep that in mind when you're looking for a doctor to try to figure out what's going on with yourself. So I hope you enjoyed this information. I hope you'll look for my other posts in the future, look for my posts from the past, and learn more and more so that you can continue your journey to better health. So I'd like to thank you for watching, and make it a great day.